Good afternoon, everyone. Dr. Aubry Tager here. Today I just want to do a little short video and talk to you a little bit about autoimmune conditions and some of the things that we're going to be looking for when you are coming into our office here at Neurologix in order to address the symptoms that you may have associated with an autoimmune condition or an autoimmune disease. So what are autoimmune conditions? We see some of them right here. We have diabetes, Hashimoto's, ulcerative colitis, Crohn's, multiple sclerosis, lupus. These are all different kinds of autoimmune conditions where your body is actually attacking itself. Now, it's not limited to these, but there are just a multitude of different autoimmune conditions that can be present. There is a trilogy of things that we look at with regards to autoimmune conditions. First and foremost, what we want to look at is the expression of genes. So basically what that means is when you have an autoimmune condition, you have expressed a bad gene. Once that gene is expressed or turned on, it can't be turned off, but it can be managed. And we're able to do that with you. We're able to find out how we can manage that in order to give you the best quality of life when you are dealing with this condition. The second thing we want to look at is barrier compromise. Almost everybody that we see with regards to an autoimmune condition has some form of barrier compromise. And when we're talking about a barrier compromise, we're talking about issues within the gut. That is where 80% of your immune system lies. So if you're not addressing the gut, then you're not going to be addressing the problem. We really want to make sure that we're taking a look at that. The next thing we want to look at are environmental triggers. What is setting this off? What is causing this problem to become worse? Just because you have that genetic predisposition to an autoimmune condition, that doesn't mean that you are going to have it, but you are predisposed to it. So if you have these predispositions and you have this genetic factor, what's going to set it off? What's going to cause it to get worse? Well, environmental factors are going to be extremely important. And when we're looking at environmental factors, we have to look at things like diet, we have to look at infections, we have to look at things like blood sugar level, we have to look at outside toxins and food sensitivities, and also things like hormone imbalances. So we're going to take all of those into account when you do come in and talk to us about how to deal with your autoimmune conditions. Once again, my name is Dr. Aubry Tager at Neurologix here in Montreal, and you can reach us at area code 514-426-6449 if you have any further questions. Thanks a lot. Have a great day. Bye-bye.